Diabetes is a disease where your blood glucose or blood sugar is too high. It used to be seen primarily in adults over age 45, but it's becoming more common in young people.
There has been a pretty much meteoric rise in the incidence of diabetes over the past decade in teenagers. It's gone from about 9% to 23% of teenagers that are being diagnosed with diabetes.
In that same time frame, obesity in teenagers has also risen to about 20% today. The first step in identifying appropriate treatment for these teens is determining the diagnosis. Type 1 diabetes is an autoimmune disease where the body produces little or no insulin to process sugars. These diabetics need to take insulin shots to manage the disease. Type 2 diabetes makes up more cases, and those rates are growing.
Now that is driven by sedentary lifestyles, by obesity, and by family history and by age. So your pancreas has to make insulin for every pound of you. The more pounds you have, the harder it has to work.
Treatments involve medication, insulin injections, physical activity, and a well-balanced diet. Rinaldi says it's especially important for teens and young adults to assume responsibility for diabetes self-management to limit the negative impact on their bodies over a long period of time.
We look at teenagers who are now developing type 2 diabetes at 16 or 13 as opposed to 50 or 60 or 70 when our grandparents develop it, and you look at another 40 years of damage that's occurring to those organs of their body.
Studies have shown that better control of blood sugar, cholesterol, and blood pressure levels in persons with diabetes helps reduce the risk of kidney disease, eye disease, nervous system disease, heart attack, and stroke. I'm Kevin Ryan reporting for St. Luke's Health System.